Hi, my name is Michelle Embleton, and in this video we're going to talk about how many embryos should be transferred in an IVF treatment. This is one of the most controversial issues surrounding IVF, as we need to look at increasing the probability of success in the treatment whilst decreasing the possibility of multiple pregnancies. So in this video, we are going to cover how do we make the decision of how many embryos to transfer, what are the risks involved in a multiple pregnancy and why we need to reduce them. We'll have a look at the procedure of a single embryo transfer and have a look at a couple of the most frequently asked questions from our users and answer them for you. Multiple embryo transfers are directly linked to increased success rates of IVF treatments. However, multiple embryo transfers are also directly linked to multiple pregnancies, such as twins and triplets, and these carry with them increased risks not only for the mother but for the babies themselves. Hence, the topic of how many embryos should we transfer is a very controversial issue within the field, and many specialists have many ideas on this topic. The general consensus is currently that only one or maximum of 2 embryos should be transferred in an embryo transfer process. This will depend on factors such as the age of the mother, the quality of the embryos, and so on. In some cases, it may be possible to do transfer 3 embryos, but this is not a very frequent occurrence. Nowadays, advances in assisted reproductive technology have increased the success rates we can get in these treatments, such as the ability to cryopreserve, vitrify the embryos so that they are then frozen to be subsequently thawed and used in transfers. Modern techniques mean that over 90% of embryos survive this process, meaning we can have more embryos available in the future to perform embryo transfers if it is unsuccessful the first time round. We also have vast improvements in the embryo culture systems. This is the actual machinery and technology available in which to grow and culture the embryos. Many times they involve time-lapse photography, so you can actually visualize the development of the embryo in real time. We also have something called the endometrial receptivity array test, the ERA, which allows us to know the optimum moment that the endometrium, that is the lining of the uterus, is ready for implantation to occur. All of these things working in conjunction allows the embryologist to be able to know the right moment for embryo transfer and select the very best quality embryos to be transferred, increasing the probability of the embryo transfer being successful and decreasing the need for the transfer of multiple embryos. When deciding the number of embryos that are going to be transferred, as well as looking at the quality of the embryos, we also take into consideration factors such as the maternal age, the origin of the egg cells, whether they are from own egg cells or whether they have been donated, the receptivity of the endometrium, and the actual reasons for the infertility itself in the first place are also looked at. Any previous cycle failures, for example, due to implantation failures, and also the stage at which the embryo is transferred. Is it transferred at day 2 to 3 of development or at the blastocyst stage at day 5 of embryo development? Embryos are classified from grade A to D, with A being the best quality embryos and D being the poorest quality embryos. We do have an article on this, and in the main article here we have a link to this article where you can find exactly what it is in the embryo that makes them a top quality grade A embryo or a poorer quality grade D embryo. All of the factors I've mentioned previously will be considered when making the final decision of how many embryos to transfer. So let's look at 2 possible circumstances. The first circumstance could be a young patient, perhaps 28 years old, with really good quality, A-quality embryos. She's not had any previous IVF failures and not had any miscarriages. In this case, it is highly likely that your specialist will choose to transfer only one embryo because the prognosis is very, very good. Conversely, in, for example, an older patient, perhaps 38 years old, with maybe only 3 or 4 quality C grade or D grade embryos, the specialist may choose to transfer 2, possibly even 3 embryos to increase the chances of the treatment being a success. As I've stated, these are always decisions made on a case-to-case basis. Indeed, many countries have laws governing the number of embryos that can be transferred, and there is a general consensus in this, as we have discussed, that the younger patient with good quality embryos, the maximum is 1 or 2, with a maximum of 3 being transferred in older patients with poor quality embryos. Usually, if donated eggs have been used, the maximum number of embryos permitted to be transferred is 2. Again, as with all the assisted reproduction treatments, laws vary from country to country, from state to state. For example, in Spain and the UK, they are tightly regulated by the governing bodies, whereas in the United States, they are more guidelines than laws. When a couple decides to undergo an IVF treatment, they may have had a long and arduous journey to get there where they are, and they are very concerned about the embryo transfer and increasing the probabilities of having the treatment being successful. The idea of a multiple pregnancy, therefore, may be very, very tempting. Having 2 or 3 babies when you've struggled for so long to have one may be a fantastic idea for the parent. But the reality is multiple pregnancies do carry with them a great number of risks for the mother and for the babies themselves. With multiple pregnancies, we have the added risk of a preterm birth. A preterm birth is a baby born before 37 weeks. And obviously preterm babies may have more health problems as they are not sufficiently developed in order to be outside of the womb in that current moment. We also have more risks of the membranes themselves during pregnancy becoming ruptured, which can lead to a preterm birth. There is an elevated increase of gestational diabetes. Gestational diabetes really does carry extra risk for the mothers and the babies. There is also the risk of the babies being underweight at birth. And finally, a risk of delivery by C-section. Obviously, the multiple pregnancies are more likely to give birth by C-section rather than a natural birth. Single embryo transfer is the transfer of just one embryo into the recipient woman's uterus. And this is the ideal goal in IVF treatments. Advantages in assisted reproduction treatments and techniques are making this more and more possible. And as a result of single embryo transfers, we have less multiple pregnancies, therefore having less risk to the mother and to the babies. Now we are going to have a look at a couple of the most frequently asked questions from our users about how many embryos should be transferred. In embryo transfer, is it the same process for fresh and frozen embryos? Basically, the embryo transfer process is the same. The differences are in the preparation. If undergoing a fresh embryo transfer, you will have had your ovarian stimulation and egg retrieval surgery, which has required a lot more hormonal medication to get to that stage. Following fertilization, the eggs are cultured before programming the embryo transfer. While the embryos are being developed and cultured, your endometrium will be being prepared for the embryo transfer to be successful. If you are using frozen embryos, perhaps from a previous IVF cycle, you do not need to undergo all the ovarian stimulation and egg retrieval procedure. In fact, the only hormone and medication you will need are the estrogens and progesterone required to prepare your endometrium to be receptive. When your endometrium is ready and the embryos are thawed and ready, the embryo transfer will take place. The number of embryos that will be transferred in a fresh embryo transfer or a frozen embryo transfer do not depend on whether they are fresh or frozen, but actually on the quality of the embryos themselves, the age of the recipient woman, and any other factors involved with previous IVF treatments or the reasons for infertility itself. Is it possible to predict which embryos will implant into the uterus? Well, not really, no. It is impossible for us to predict which embryos will implant, despite all the advances in assisted reproductive technology. However, with everything that we know, we can identify which embryos are more likely to implant from their good quality and the characteristics they have to aid them in their implantation. Implantation is actually a very complex process between the endometrium, the lining of the uterus, and the embryo. And hopefully in the future, with more research and investigation, these sort of questions, the answer will be yes. We would like to hear about your experiences with embryo transfers. How many embryos did you have transfers? Did you have success? Have you had a multiple pregnancy? Please do leave us a comment below. And if you've enjoyed this video and found it useful, don't forget to click like and subscribe so you don't miss any of our future videos. And as always, I would like to remind you that in the description below, I leave you with a link to an article on this topic where you can read more about this in detail. Within this article are links to other articles such as how embryos are classified from A to D and more about the risks involved in multiple pregnancies.